Welcome, everyone. Thank you for joining us this evening. Next slide. This evening, you have joined our Lupus and You educational program on managing lupus at work. I'm Matt DeGoyer, and I'm the Regional Director for the Lupus Foundation of America in the Pacific Northwest. Next slide. This evening, we will have a really terrific program for you, including Paula, who will share some information about our tips and tricks. Sorry, I have something kind of blocking my screen here, so I'm going to move that. So with this evening, Paula White with GSK, who's going to share some tips and tricks on finances and insurance. Our lupus warrior, Erin Elsasser, and Hollie Egan, who will lead us through managing lupus at work. And we will also have Dr. Ebony Hilton join us from the University of Virginia to give us an update on COVID-19 and, fingers crossed, hopefully a little bit more about all those booster shots we've been hearing about. And whether you're new to lupus, newly diagnosed, or have been living with lupus for a long time, I will share a little bit about some of the wealth of resources that we have available to you at the Lupus Foundation. Next slide. I'd like to thank our sponsors, GSK, Pfizer, Pharma, and We Work for Health for their generous support of this evening's program. Next slide. A few housekeeping items. We would love for you to ask questions. If you look at the bottom of your screen, you'll see a question and answer button. You can click on that button to ask your questions, and we'll get to as many of those after each speaker as we are able. If you prefer for your question and your identity to remain anonymous, I believe there's a little box that you can check to remain anonymous as well. If your question is very specific to your own medical condition, you may want to consider reaching out to one of our health educators. I'll be talking a little bit about that more later in the program. And lastly, we hope you'll rewatch and share this webinar. It is being recorded, and we'll be sending the link via email after the event to all of you who have joined us this evening. Next slide. So with that, I would like to introduce Paula White. Paula is a registered nurse and patient engagement liaison with GSK. She has 25 years of experience with acute care and community health settings and has spent 20 years educating patients. So with that, I'd like to hand things over to Paula White with GSK. Paula, welcome.
Sorry about that. Am I off mute now? Thank you so much. I am going to move my screen as well, so I'm not blocked. Well, thank you, Matt, for the warm welcome, and thank you for allowing me to speak with your group this evening. As Matt mentioned, I am going to share with you briefly, probably the next 10 minutes, 5 to 10 minutes, about some of the financial and insurance components to managing chronic illness, and hopefully help you to be able to feel empowered to navigate through some of the costs and insurance information regarding chronic illness. There we go. So what contributes to the costs that is impacting those of us when we face chronic illness? So first and foremost, medical appointments. So each of you may have multiple specialists that you have to see on a routine basis. It's important whether your specialist makes you on a schedule of every 3 months or 6 months to keep those scheduled appointments. Some of that may, entail co-pays, that sort of thing, but it's critical that you see any medical team members or specialists as is recommended Unexpected costs, so urgent care costs, ER visits, sometimes hospital stays can come into play that can generate really unexpected costs throughout the year. It again is important that if you do need to seek medical care and you feel that it is important, you've had a change in your health status, that you do not let costs stand in the way. We'll talk about some, obstacles about how you can maybe mitigate some of the financial costs, but don't ever let that stand in the way of you seeking urgent care if needed. Medications, various medications may be in your bag, if you will, from multiple specialists. There are some tips and tricks we'll talk about that may be able to help you when you have multiple medications that are involved oftentimes when you suffer from chronic illness. And then finally, the impact of perhaps missed work or school. There's a study out of UK in 2018 that mentions about 40% of people have had to leave the workforce or alter the level of involvement that they have been in the workforce. And that nearly 100% of the patients or people surveyed stated some sort of missed work or employment involvement in their lupus and chronic disease and being able to remain in the workforce. And we'll talk about some of that. So how can we manage some of these costs? How can some of that overwhelming feeling that you may have looking at the areas we mentioned, how can we manage that and take care of some of those costs and feel empowered again to ask the right questions to be led to a means of seeing, is there a way to manage some areas of the costs related to chronic illness? So, hang on a minute. So, as mentioned, it's important that you communicate with your healthcare team, and you have to be able to ask the right questions and share with your doctor and that healthcare team if you are having financial concerns. They can often help or guide you to the right person to speak with if they are made aware of these concerns. So don't ever feel that it's something you cannot speak with your doctor about. Oftentimes the specialists that you are seeing have dealt with some of these cost parameters around navigating chronic illness. So please share with your doctor if you are running into those concerns related to medication or office visits and that type of thing. Some important people that the doctor may direct you to could be the billing specialist. So within the health insurance, there is someone specific that you can maybe flip over your insurance card and call and talk to them about the costs of your health insurance plan and understanding your health insurance plan, what is covered as far as physician visits, what is not covered, that sort of thing. Benefits representatives. So again, through the health insurance, perhaps in the doctor's office, there is someone within those organizations that can help you answer questions as to how you can navigate some of those insurance costs related to office visits and medications. They're most oftentimes, especially dealing with specialty physicians' offices, there's oftentimes a patient coordinator and a biologics coordinator. If you don't know these people in the office, you probably want to make them your new best friends. They oftentimes have interactions with the insurance companies themselves and know some of the plan details that may be involved with your specific plan. They may also communicate on a regular basis with some of the treatment option medication companies. For instance, I work for GlaxoSmithKline, as Matt mentioned. Some of those, the biologic specialists in the offices that are coordinating that care for you have a close relationship and may have phone numbers or contacts that you can reach out to help with some of the treatment and medication costs that are involved. And then the pharmacist. So when you think about a pharmacist, there may be a local retail pharmacist that's involved that you're getting medications from, but oftentimes there's a specialty pharmacist that may be involved that you may only deal with over the telephone. So they also oftentimes can help you answer medication questions that can help navigate through some of the patient assistance programs and that sort of thing for different treatment options. Again, being open to your healthcare team and honest and upfront with them so that you can make sure to get the care you need and don't feel like the financial burden is preventing you or standing in your way. Just some questions here. I'll upload how to really start having that conversation, or what should some of the questions maybe look like that you may be needing to ask. So, do you think my insurance will cover this visit or this medication? Do you offer a payment plan? So sometimes when you go in for either urgent care visits, some of your office visits, if you're going to an infusion center for treatment administration, sometimes they'll have a payment plan. You can pay a portion and then break down some of the payments to help offset costs. You know, keep in mind too, maybe at one point you may not need the assistance, but perhaps you will in the future, or maybe something has changed financially. And don't be afraid or shy away from speaking up and sharing that. I mentioned the pharmacist, some of the prescription discount programs that may be available to you. If you ask the question, you will be able to get answers or be led to hopefully the appropriate person to answer that question for you. Again, it's important to ask questions and not feel afraid to ask questions. So, understanding your summary of benefits and coverage, this is something you can reach out to your insurance to. I know November, toward the end of the year, is oftentimes for patients, whether they're commercially insured or Medicare or Medicaid, to make insurance selections and options. And it may need to change. Perhaps your employer is switching plans, that sort of thing. So it's always important to know the correct contact phone number to really reach out and understand your summary of benefits and what coverage options look like, and know when you're making the selection that you have mentioned your chronic illness and that you're making the most effective selection for your insurance coverage the next or incoming year. Formularies, so this is related to medications and your prescription coverage. There are tiers with insurance companies you've probably heard of. So medications can be tier 1, tier 2, tier 3, and even tier 4 now. So some of the prescription plans within certain insurance companies or under your pharmacy benefit can vary. So it's important to understand the coverage options, especially in dealing with lupus and chronic illness. You may often be dealing with specialty drugs, if you will, and understanding where some of those medications fall in that formulary coverage. So here, there's a need for understanding of the medical benefit versus the pharmacy benefit when it comes to care. So under the medical benefits, you can see medications that are administered within your doctor's office themselves would fall under this benefit. And usually these, we've heard the word copay. Sometimes if you go into the office and the physician gives you a medication, injection or infusion, it may be billed under a medical benefit, and each time you would have a copay then that you would pay in the office. If medications are run under that pharmacy benefit, that could include medications maybe that you may administer at home yourself, that may be shipped to you at home or come through that specialty pharmacy benefit. And that is when we start to look at the tiers for coverage and what the out-of-pocket cost may be based on the various levels of tier coverage. So understand that, and that can be, through speaking with your pharmacy benefit provider. So just some additional resources I'll share as we wrap up here. turning to the insurance company and understanding your health insurance. The pharmaceutical companies, most all that I know of, have copay assistance programs to help with treatment. So don't shy away from asking for a phone number. If you really Google almost any medication that you're on, you can actually be led to a website called the consumer website, or for patients, that can lead you to any assistance programs that may be for any specific medication that you are on. There may be a number there and just some literature that you can read and see what sort of options may be available to help mitigate some of those costs. There are prescription discount sites that would be easily to be obtained, perhaps through your pharmacist, that may be able to share some of those with you as well. And then, as you're taking part today, advocacy groups. I'll tell you, the warriors on this call, Matt and Kelsey and Samantha, I really think the advocacy team is a great resource. And speaking with some of the other warriors that are part of the chapter that you're involved in, that have navigated some of these challenges in the past, and some of the conversations that you're going to have in a bit, will be able to share some of that information as to their experiences. But I think to always have an advocate or someone that has walked in your shoes as you're doing so you're in the right place. Understand that. And again, just a final thought, remember to be proactive upfront if you're aware that you're having any health insurance changes. Adding any care providers to your team. Make sure that you get to know the important folks in the office. As I mentioned, there's biologic coordinators. That just means the person in the office that oversees the medications and treatments that are involved in chronic illness. They have close relationships to the pharmacy, to the insurance, and also to any pharmaceutical company benefit prescription programs for you. And with that, I am wrapping up and hope I was within my time, because we've got some great speakers coming up. And if there is time or any questions that have come in for me, I can take those, or comments at all.
Terrific. Thank you, Paula.
Thank you.
We did have one question. Okay. One participant asked, what is a biologic coordinator and what do they do?
So within the physician office, oftentimes specialists deal with a large amount of prescription medications, and they can be specialty medications in that it's not just a prescription that's written that you go fill at your local retail or pharmacy down the street. So they have someone that works with prior authorizations, if you've thought about that. Oftentimes these specialty medications have to be pre-authorized through the insurance company, and the biologic coordinator can work to provide physician notes from your visits to help get that treatment that the doctor has prescribed and suggested, recommended for your care, approved through the insurance company. So that is, the biologic coordinator or prescription coordinator within the office. And oftentimes they can really provide answers to questions related to treatment options if you let them know that you do need help with coverage.
Terrific. Thank you very much, Paula. We appreciate your insight and tips.
Yeah,
and
welcome.
We're so grateful for your time this evening. Thank you.
Thank you so much. Thank you for having me.
Absolutely.
I will stop sharing. There we go.
So at this time, I would like to welcome our keynote speakers, Erin Elsasser and Hollie Egan. Erin was first diagnosed with SLE in 2008, and she's worked her entire career in a fast-paced environment, including 25 years with the same company. She recently took a medical leave of absence and ultimately decided to leave the company this past year. And since then, she has been continuing her work as a lupus warrior and assisting with our LFA advocacy efforts. Hollie is a human resources consultant and job search coach in the Seattle area, and she brings a vast HR management experience and expertise from a wide variety of organizations. And she guides her clients on issues including legal protections of employees, employee engagement, and organizational development. So welcome, Erin and Hollie. Thank you.
Thank you so much, Matt, for that lovely introduction and for inviting us to talk about managing lupus in the workplace. I will talk about my experiences with lupus, my diagnosis, mistakes that I believe that I made, and recommendations that I have based on my experiences. Hollie is the one with the professional HR background and will go into more detail about those legal protections you can expect as an employee with lupus. And we will share this slide deck so you'll have access to all of this information.
Sorry to interrupt, Erin. You might want to lift your microphone a little bit closer.
Okay, thanks, Matt.
Sure.
Next slide. Okay, great. And next slide. Thank you. I'm happy to be sharing my experiences today in the hopes that this information may be of help to some of you. Some of this information will be most applicable to people newly diagnosed with lupus and trying to figure out what they should do at work. Many of you have already been living with lupus for a long time, have already had discussions with your employers, may have even gone on a leave of absence. In any case, our intent is that everyone will get something out of this session and that after the session, people will share their experiences with one another in places like the virtual support group sessions, and we'll share the sign-up information for those sessions. I don't want my experience and opinion to be the only one, but perhaps the start of the conversation. As Matt mentioned, I was diagnosed with lupus in June of 2008. It started with Raynaud's syndrome and painful joints, and it took about 6 months for me to get a positive diagnosis. I didn't share the news with anyone outside of a few friends and family members, but I knew I would have to tell my manager as I was missing a lot of work for doctor's appointments and had no idea how the disease would progress. Plus, I was having difficulty carrying my very heavy laptop, and my doctor suggested requesting a lighter one. I was confident that my manager would be empathetic, and he was. But I didn't want to tell anybody else. I was career-oriented, and I didn't want to be looked at as the sick one, the person incapable of taking on the cool projects. Which was actually really silly, as once I started taking the high doses of prednisone, gaining 25 pounds in 2 months, and having a moon face, which some of you I know have experienced, people knew something was up. But I thought I was tough enough to just deal with everything on my own and not ask anyone for help. This went on for many years. As I moved to different groups, I tried to keep everything to myself, only sharing if absolutely necessary. I was also fortunate that I was never admitted to the hospital and was able to continue at work with only a few days off here and there. But a kind of turning point came in 2019 when I went to the Lupus Advocacy Conference in Washington, D.C. It became so clear to me there how important it is to share the story of lupus and that story is so much bigger than just me. I was so inspired by the stories of so many strong people suffering with this disease. I was determined not to be quiet about it anymore. So after sharing my own story with my senators and representatives' offices in DC and learning so much at the conference, I got home and decided to tell my coworkers and my team that I'd had lupus for over 10 years. I started to educate them on what it is, how it impacts my life and the lives of others, and how they can make a difference. It felt great to finally build awareness and help people understand more about this disease. And it was actually good timing for me to start sharing this information as my health started deteriorating a few months after my return from DC. I was having a very hard time concentrating, retaining information, making decisions, and staying on top of a high-stress job. My manager and others were noticing that I was not myself. I wasn't keeping up. I wasn't as quick thinking as usual. I was spending long days in my office, but not seeming productive. I would read the same thing 5 times and still not retain it. I was often frustrated and disappointed in myself. After a number of months of struggle, I spoke with my manager and we decided that I should take some time off and focus on my health. Even though I'd been more open about my lupus journey, it was still difficult for me to admit that I was having lupus-related issues that required me to take time off. What I learned, though, is that my manager, peers, and HR team were fully supportive of me. They were offering help. I just had to accept the help, and so I did. I left my job to go on short-term disability leave in January of 2020. This was provided through an insurance program with my employer. My goal was to take a month or so to rest, relax, take an online class or two, and catch up on Netflix. Then I wanted to travel to visit some friends and spend more time with my family. But plans are funny things. In February, 3 weeks after going on leave, my partner David and I decided to get a puppy. This wasn't exactly the relaxation that I was looking for. And then 6 weeks after that, the country shut down from COVID. So everyone went home right along with me, well, nearly everyone. I trained my puppy, went on lots of walks, spent lots of time inside being concerned about COVID and my and everyone else's health. And by the time the 6 months of my short-term disability leave were coming to an end, I had made the very difficult decision to quit my job and make my departure from work permanent. I didn't feel at that point that my cognitive function was improved enough to go back into my previous job, and a different role wasn't the right option for myself or for anyone else on my team. But let me make the very important point that this was my situation. My company was prepared to take me back. And I was also in a unique position or unique situation that I'd been working for over 25 years and had some money saved. So I did have the ability to take some time off. So I have been off work for 1.5 years now. This time has allowed me to get healthier and remove the biggest stressor from my life. I don't know if or when I may go back to work, but if I do, I'll make certain that my employer knows my situation and is flexible, understanding, and supportive of people with challenges like lupus. And I'll make more time for myself and for my health. Next slide. So here are my recommendations for working successfully with lupus based on the things that I would have done differently if given the chance. This is my advice based on my experience and my employer and coworkers. Everyone's situation is different, so please consider what may work best for you. Unless you really believe that you will be discriminated against, which is not legal, and Hollie will share more about that next, share your story. Speak with people around you who you believe will be your advocates, your friends, your support system, and perhaps even lupus advocates too. You don't have to share with everyone, but it is very freeing not to keep this very important part of your life to yourself. Don't do everything yourself or believe that you need to take this disease on all alone. Many people around you are happy to help, especially if you're clearly struggling. Think about it this way. If you saw someone struggling, you'd jump in to help, right? Of course you would. Then why wouldn't someone else want to help you? Ask for and accept help from others. And by help, I mean something as simple as asking HR for office setup accommodations like a different mouse and keyboard to help with joint pain, to requesting to continue working from home if everyone is going back to the office and you and your doctor are concerned about the Delta variant. Or it can be requesting time off. Help comes in a variety of forms, which takes me to be real with yourself about what you can take on and what you just cannot, and also stay healthy. No one can do everything. We only have so much energy in a day. If you feel that you have to say no to a work request because you're doing too much, ask your manager what you should prioritize. For example, if I create this presentation for Thursday I won't have time to go to these 2 meetings tomorrow. Which would you rather I do? This is where it's helpful to have disclosed your health situation to your manager or HR, especially if your performance is suffering like mine was. They'll understand why and be more accommodating. Get to know your HR manager, or at least who he or she is, in case you need that person down the road. If you work in a company bigger
Matt, I'm going to send out a quick email. It looks like folks are rejoining, but I'm going to send a quick message letting them know that we're back.
Great, and I'll make an announcement to our participants. Welcome back, everyone. We apologize for the technical difficulty. We had someone interrupt our Zoom meeting and service, so we're rejoining. Thank you very much for your patience. We apologize for the inconvenience. Welcome back, Erin.
Thank you.
Yeah, apologies for that. We had someone interrupt our Zoom meeting. We're back on track. It'll be just a moment and we'll get the presentation back up.
Okay, great.
Thank you for your patience, everyone. All right, Kelsey, I'm not sure if you're able to pull the presentation back up.
Yep, give me just one moment, Matt. Apologies for the delay.
Sure, no problem. For those of you who are rejoining, we'll be starting in just a moment. There we are, our presentation is back up. Apologies for the interruption. Erin, please feel free to continue. Thank you.
Great. Thanks, Matt. I hope we didn't lose too many people, but I think I was at getting to know your HR manager, which is very important in case you need that person down the road. If you work in a company bigger than about 50 people, it's likely there's someone working specifically on human resource issues, benefits, payroll, etc. That person will be your connection for any questions around ergonomic office setup, getting a lighter laptop to carry like me, laws around disability benefits and how employees can expect to be protected, the Family Medical Leave Act if you need to take time off for yourself or to take care of a family member with lupus. Your HR partner is a vital connection to have. One point that I didn't add to this slide, but I think is very important, so I will mention, plan ahead as much utilize the lupus.org once a month. They're a great way to connect with others, talk about your challenges, and get great advice from others going through similar experiences. And with that, I would like to introduce you to Hollie Egan, who is one of those great human resource connections. Hollie will go over your rights and what you can expect if you ever need to go on disability or medical leave. Hollie.
Thank you, Erin. Hearing your story was really inspiring and meaningful. I'm sure a lot of people got a lot from it. So thank you. Thank you for sharing. So as Erin mentioned, I'm going to discuss a little bit more about employee protections, specifically legal protections that I would encourage you to become a bit more familiar with if you aren't already. So the first one would be around accommodations. So under the ADA, which stands for the Americans with Disabilities Act, which is a federal act, companies are obligated to comply with protecting employees who have disabilities and providing them with reasonable accommodations to enable an individual with a disability to perform their job. You may be wondering, what is reasonable? And, essentially, and this is a really important part of ADA and accommodation, essentially anything required that still enables that individual to perform the essential functions of their job. That is what is deemed reasonable. It is up to an employee to report a disability. So I would encourage you to, work with, any applicable HR partner, as Erin had mentioned, or benefits team to go through this process. Essentially what happens is a company would engage with an employee who requests some sort of accommodation in what's called an interactive process, and then make an individualized assessment of that request. One thing to note around accommodations is they should be provided in cases where that accommodation would not directly threaten someone's health or safety or create an undue hardship for the company. One other thing to note as it relates to accommodations is that you may be required to provide some sort of medical verification of your disability along with that need for accommodation from your doctor by submitting, medical information to whomever manages that process for your company. It sort of varies. Like Erin mentioned, if you, have a company that's, 50-ish employees, you likely have a dedicated HR manager or HR business partner. If you work in a smaller company, it could be, more of a benefits specialist or someone who's taking on other responsibilities and sort of plugs and plays with from an HR standpoint. It just sort of depends. I do want to note that, medical information will be treated as confidential in accordance with any applicable law. So I do want to mention that. And we can move to the next slide. So some examples of possible accommodations under ADA that I wanted to touch on. One would be, part-time or modified work schedule, as well as working from home. So I know, the work from home concept is becoming a lot more common, with re-entry back into the office happening sort of in this somewhat post-pandemic, dare I say that, world. I know that a lot of companies are thinking about what they're calling hybrid models. So, really kind of bringing people back so that they can have a blend of in-person work coupled with still having some work from home. So I would encourage you, if you're in conversations with your doctor and you're thinking that work from home could be a possible reasonable accommodation for your situation, to really talk about, how are you all feeling about the effectiveness of the vaccine? What might make sense for your particular situation, and how might that fit in with an accommodation for your role? Other things that Erin had actually mentioned earlier, which were great examples, acquiring or modifying new equipment or devices, some sort of leave of absence for a defined period of time, which could include an extension of that leave as well. So that is sort of what I wanted to discuss regarding accommodation. Other legal protections that I want to be sure I touch on here and go into some detail. One would be the FMLA, the Family Medical Leave Act, which is essentially a federal act and job protected unpaid leave of absence. That's a mouthful. That's what FMLA is. Washington PFML, Washington Paid Family Medical Leave, is a Washington state insurance funded program that is similar to FMLA, but not FMLA, however, runs concurrently with FMLA. So when we get to the next slide, I will go into a little bit more detail on how those two programs differ. But I also wanted to mention, other employee benefits that companies tend to provide, being, short-term and long-term disability, which, are essentially insurance programs that employees and employers pay into, and, can range from, income supplementation anywhere from 40 to 70% of an employee's pre-tax income for a specified amount of time. One thing that's really important to note with short and long-term disability is just that, approval decisions are really made by the insurance companies, not your internal HR departments, and really based on information that's been provided by the employee and or the medical team. So wanted to just mention that as well. We can go to the next slide. So to go into a little bit more detail around FMLA, which is the federal law, from an eligibility perspective, you essentially, it applies to companies that have 50 or more employees within a 75-mile radius. The employees must have worked for the employer for at least 12 months or 1,250 hours prior to the start of that leave. And, a qualifying reason is something like your own serious health condition. What else do I want to mention there? FMLA does require an employer to maintain an employee's health benefits. So I think that's important to note during a leave, and also restore an employee back to their same or equivalent job after leave. So it is job protected time. Generally speaking, an employee is supposed to give 30 days notice if they are needing to take an FMLA leave when he or she knows that the need is there, and it's possible and practical to do so. It isn't always, and it's not something where you're going to be turned away if it's within 30 days, but just a guideline for you. And then another note is just that FMLA may be taken intermittently or on a reduced work schedule basis. So it doesn't have to be, a consistent 12-week period, 8 hours a day, that type of thing. It can be done on a more intermittent basis. Similarly to FMLA, Washington residents are eligible for what's called PFML, which is paid family medical leave. It is similar to FMLA in that it is leave that you can take for similar criteria of medical related condition. And it actually applies more broadly. So for the most part, there are a couple of exceptions, but for the most part, all employers who have at least one employee in the state of Washington are subject to PFML. So you must have worked for any company in Washington for 820 hours on either within that year on either a full-time, part-time, temporary, or seasonal basis in the last year. And employees can keep their health insurance while on PFML, but slightly different than FMLA, they must pay their portion of the premiums if they pay a portion of premiums with their employers. And if you're approved It's a state-run program. If you're approved for PFML, you essentially can receive up to 90% of your weekly wages with a minimum of $100 and a maximum of $1,000 per week. And this is something where, because it's a state-run program, you'd actually be paid by the Employment Security Department rather than your employer. So that's how that works. So the real differences there are, you know, with FMLA, FMLA, you have to have worked 1,250 hours or for a 12-month period with that employer, whereas PFML can be any employer in the state for only 820 hours. And one other point I want to mention around PFML is it is also job protected leave if you meet the eligibility criteria as defined in FMLA. So it's a little bit confusing, but for it to be job protected leave, you also need to have worked for that same employer for the 12 months and for at least 1,250 hours, if that makes sense. One website I would point you to if you think PFML could be an avenue that you would like to pursue further. I've included it on the slide, so it's just paidleave.wa.gov, and there's some really useful information out there. You can look at like an employee portal, an employer portal to see what considerations they look at too. But it is a nice option. We can go to the next slide. So I guess in closing, and I would just offer a few just sort of general tips that I didn't put on the slide, but you know, I think this has been sort of a common theme through each speaker today, which is just sort of open communication, right? So as it relates to the topics that I just covered, you know, really encourage you to have open communication and dialogue with your manager at work. It is a slippery slope. You know, you don't want to be disclosing, you know, every nitty-gritty medical detail to your boss. However, you need them to understand, especially if you think that you might need to utilize some sort of leave. You need them to sort of understand what's going on. I think that really also aids in just the relationship and the trust that you build with that person, and their overall willingness to just work with you on things that are reasonable. To reiterate things that Erin had said would just be to sort of accept the help, right? I think utilize the resources that are available to you. They are there for a reason, and your health is really critical. It's the most important thing. So that's what I would say as far as a little bit of advice. Thank you.
Terrific. Thank you so much, Hollie and Erin. We do have a couple of questions.
Sure.
First, do you happen to know if Oregon has a similar PFML program? And second, does lupus, all of the various kinds of lupus qualify as disability?
Great questions. So, you know, I don't know the ins and outs of the Oregon law, but I seem to recall that they rolled out something very similar to the Washington PFML around the same time, or perhaps a little bit sooner. So I would encourage you to, you know, look into that, whether just sort of, you know, looking online or checking with your employer if you're employed with an Oregon company or live in Oregon. I seem to think that they have something similar. In terms of the types of lupus that would be covered under disability, that's a tricky question for me
to touch on that one,
answer.
Hollie.
Yeah, do you want to touch on that?
Yeah. So it's not a specific list of diseases that are covered. It's situational. So depending on what's going on with your health, what you're unable to do in your job, that's really what they're looking at. It's not specific to, oh, if you have SLE, then that's a disability. If you have lupus nephritis, that's not a disability. It's more situational than it is specific to one particular disease or another.
Terrific. Well, thank you both very much. Those were all the questions that we had today, and we can't thank you enough for sharing your expertise. Thank you again.
No problem.
At this time, I would like to introduce Dr. Ebony Hilton. We're thrilled to have you with us this evening. Dr. Hilton is a doctor and professor of anesthesiology at the University of Virginia, Charlottesville. She's also an award-winning children's book author and is a lifelong advocate serving America's underserved and marginalized communities. She is also an on-air expert on television related to areas that I just mentioned. So Dr. Hilton, we're thrilled to have you with us this evening.
Yeah, certainly. And I'll try to, I know we're doing a Q&A session afterwards, and so I try to keep this little presentation as brief as possible to answer anyone's questions. But what we know about COVID-19 is that there's a lot we don't know, right? We know that it is a global threat. And globally, what are we looking at? It's 191 million cases of COVID-19. And unfortunately, it's claimed the lives of 4.1 million persons. Now, nationally, we're looking at about 34 million cases of COVID-19 in the United States, with about 610,000 deaths that we can at least confirm are from COVID, but we know that that death count is thought to be much higher than that due to the lack of testing early on in the pandemic. Now, we know that otherwise, the other thing that we know to be true is that death is not the only consequence of COVID, that we also have long COVID that we have to weigh into whether or not we are going to get vaccinated or we're going to risk exposure and infection with COVID-19. And there are a couple of different studies that have come out. There's a report by Fair Health Study. It was over 2 million persons that were included in this study. And what they were seeing is once persons knew that they had COVID-19, were they still experiencing these symptoms? And of those 2 million persons, what they found is that 23% of those actually had symptoms for greater than 30 days. And even for those who were asymptomatic, people who literally didn't have any signs and symptoms of COVID-19, they just went and got tested and then were found to have been infected with COVID-19, that 19% of those persons actually said within the 30-day span, they were still having symptoms of either changes to their GI tract, either COVID brain, or feeling like they had a lack of attention span. Even some lab work, hypercholesterolemia was found in adults. And these changes, we don't typically see them with other viruses that we come into contact with, in particular of the coronavirus family. But with COVID-19, we are seeing that, right? And so with that, we had to start shifting our thoughts of what can we do to possibly save people's lives? And unfortunately, we have vaccines that can do that. I was actually the first person vaccinated at UVA on December the 15th, was fully vaccinated by January 5th. And since that time, we in America have vaccinated about 161 million persons fully. But that's still only 49% of us, right? We've done a fantastic job at the elderly population. If you're older than 65 years old, about 80% of those persons we've vaccinated. But it's the less than 65-year-old group that they were really having a difficult time getting us up to that herd immunity threshold that we think we have to reach of about 70 to 80% of our population. And in March, we were vaccinating probably around 3 to 4 million people a day. We're now down to about 500,000 people a day. We have a big move that we have to keep pushing. And I think having conversations like this may help to bring persons, if they are debating whether or not to get vaccinated, we're having these true, transparent conversations, and it may kind of sway you. Because with this vaccine hesitancy, what we're seeing now is a new fourth wave, and I don't even know if we can call it a wave because we never really had, we never really got back to zero, but a fourth surge. Nationwide, we have an increase of about 198% in our cases over the last 2 weeks. An increase of 45% in our hospitalizations, and unfortunately, an increase of 44% in our deaths, even though we're down 13% in our testing over the last 2 weeks. And if we go back 2 weeks, that puts us at July the 4th, right? So we're seeing the consequence of lifting of the mask, of vaccine hesitancy, really showing us that we're not out of this pandemic quite yet. And it's literally in every single state that we're having these increase in our cases at this point. But we do know that in the Southeast and in the Midwest, we're seeing a huge uptick. And to give you examples, Mississippi is about 308% increase over the last 2 weeks. Alaska, I think it was like 400% increase. Louisiana, 370% increase. And with these states, what we're seeing is that they have low vaccine uptake. And so I'm hoping now to kind of open up to any Q&A that persons may have, because I know particularly if we have comorbidities, if we have conditions that have, challenged our immune system, it can make it a little bit scary to say, you want to give me a vaccine, this new vaccine that's on the market. But I'm hoping that by the end, we can convince people that it is a safe option for you to take.
Dr. Hilton, what are we hearing about how long the vaccines last and about the necessity for booster shots, and in particular for those with compromised immune systems? What does that all mean?
Right. So with boosters, and I think we have to remember, there's a difference in a booster and a difference in a series. And right now, we're not sure if this is going to be a booster or literally just saying that for example, with the hepatitis shots, we know we have to get 3, right? You have a series of those injections. Today, there was a study released about the Johnson & Johnson vaccine that says that maybe perhaps those persons, because of the impact of the Delta variant and the Lambda variant, that we're seeing that it's maybe not as efficacious as we would like it to be in comparison, particularly with the mRNA vaccines. And so this is going to be something that is still evolving of whether or not those persons with the Johnson & Johnson vaccine may need a second dose. Will they be actually offered a dose of the mRNA vaccine and let that be the booster for their immune system? But at this stage, what we do know is that in comparison to persons who have not been vaccinated at all, those who have been vaccinated have a decreased risk of dying from COVID-19. You have a decreased risk of having a severe case of COVID-19 that lands you in my ICU, needing a ventilator, needing a lung transplant, or any of those more invasive type measures. So that's what we have right now. And again, I know that can be very troubling for persons when we say we don't simply know that we're still collecting data, but that's just the state of where we are in this pandemic. There's going to be a lot of unknowns that we're uncovering, but I hope to ease the mind of persons as far as the vaccines. What we do know is that there's literally millions of us, 161 million Americans at least, that have already had fully vaccination or at least 2 doses of the mRNA vaccines and at least 1 dose of the Johnson & Johnson. And we have that data to rely on. And the safety profile is there for it.
So we do have an additional question, and you were just hinting at it earlier, but if I got the J&J vaccine, should I get a shot of the Pfizer or Moderna?
Right. And right now, I think that's going to be a topic that the CDC and FDA are going to have to come to grips with. This new report literally was just now released that I read maybe 2 hours prior to this. And the report last week, there was a report of Johnson & Johnson said that persons are fine, their antibody titers were fine and no need to worry. But we're constantly getting in new information from different countries that are also running these same tests so we can compare and evolve with this virus and this pandemic as it shows us whether or not it is able to evade our immune system. At this point, what I would say, particularly for those who are on immunosuppressants, is talk to your doctor. You may be one of those persons, depending on what your current state, if you're having any active flares, if there's any signs that your immune system may have been compromised, that they may say, let's look and see about getting you a second dose. There's plenty of clinical trials that are ongoing because, again, it's a lot of unknown. But the safest thing that we can do is, particularly what I tell my family members who have conditions that lead them immunocompromised, is to protect yourself with masks, practice those social distancing. Those are going to be our best bet, particularly as we're seeing these rising cases in literally, like I said, every single state of the United States of America.
Terrific. Well, Dr. Hilton, you just answered our final question. Someone was just asking about mask adherence for those who are immunocompromised. So thank you very much. We sincerely appreciate your sharing your expertise, and it was delightful to have you this evening.
Thank you. You all take care.
Thank you. So many of you have lived with lupus for quite some time, but some of you are also new to this disease and recently diagnosed. I'd like to just share a few pieces of information about the resources available to you with the Lupus Foundation of America. Next slide. As you know, at the Lupus Foundation, our vision is a life free from lupus, and our mission is to improve the quality of life for all people affected by lupus through our programs of research, education, support, and advocacy. Next slide. On lupus.org, we have a vast array of resources, and there are also some ways that you can get involved. RAY, Research Accelerated by You, is a recent addition to the programs that we offer at the Lupus Foundation of America. No one understands lupus better than you. And through RAY, we are able to document your story and your experience with lupus and share that with researchers. And this guarantees a brighter future for lupus research. So if you are interested in giving back and sharing information about your own unique lupus, I'd recommend that you go to lupus.org/RAY. Next slide. On lupus.org, we have one of the largest patient-centered resource libraries on lupus in the world. I go there almost every day. There are hundreds and hundreds, if not thousands, of articles that really track anything from those who are newly diagnosed to those who have been living with this disease for a long time. So if you have a specific question, you can always go to lupus.org/resources and search our National Resource Center on lupus. Next slide. Sometimes what you're really looking for is a personal touch, and our health education specialists are able to provide that. While they're not able to give specific medical advice, they can help you navigate the healthcare system and connect you with truly important resources. You can go to lupus.org/health education specialist to find a phone number as well as an online form to connect with one of these specialists. Next slide. And lastly, if you're newly diagnosed, I recommend that you take a look at Take Charge and sign up for our introductory 12-week email course. This provides tips and tricks for people newly diagnosed to learn how to better manage their disease. Next slide. And lastly, community is incredibly important to those living with lupus. As we move into the fall, we will celebrate this community through our Walk to End Lupus Now. While we'll be virtual again this year, we are incredibly hopeful that next year we'll all be able to gather in person. But sign up for the Walk to End Lupus Now. It's a great way to share your story, your lupus story, with those in your network and your community. It's also an opportunity to raise funds for research and educational outreach that we do every day at the Lupus Foundation of America. So go to lupus.org and search Walk to End Lupus Now to sign up your team and to reach out to your friends and family. Next slide. So thank you very much for joining us. We appreciate your patience with the technical difficulties. We hope you have a wonderful evening, and thank you again for joining us. Good night.